The topic of discussion today is Hep B and liver cancer. We have two experts here with us from the Department of Gastroenterology from UCSF as our speakers today. On the bottom of the screen, you can type in questions in the Q&A box as the speakers are talking, and then at the end, we'll address your questions when they're done. Given how long we have put our attention to the pandemic and now the triple-demic, we have neglected many important chronic clinical situations during this time. It is important that we take back up some of this attention to these important clinical areas. And one of those very important areas is Hep B and liver cancer, because these two diseases carry a disproportionate burden in the Asian communities. Why do we want to mention Hep B in the midst of the respiratory infections when we have the triple-demic still? Because Hep B can kill. Hep B is common worldwide, especially in many parts of Asia and the Pacific Islands. We wish to call out to your attention that Hep B disproportionately affects Asian Americans. The data shows that chronic Hep B affects Asians and Caucasians quite differently. From the Office of Minority Health, a 2018 surveillance shows that Asian Americans were almost 8 times more likely to die from Hep B than the non-Hispanic whites. Asians with chronic Hep B have liver cancer rates also up to 13 times higher than Caucasians. According to the Center of Disease Control and Prevention in Atlanta, 862,000 Americans are living with chronic Hep B today, and many are unaware of their infections. And that's why we bring this topic to you today, because many of you who sit here may never knew that you've had Hep B and you might be a chronic carrier. And so the two physicians are going to bring it to your attention and ask you to do some of the things that you should do if you haven't done so. So, but of those 860,000 people infected with Hep B, with chronic Hep B, 60% of them are Asian Americans, when only 6% of the US population are Asian Americans. So we have a lot more people in proportion to having Hep B than the population itself. So do you know if you've ever had Hep B? You won't know unless if you get tested, and the physician is going to talk to you about testing and screening for Hep B later. So anyways, without further ado, I'm going to introduce our two speakers. But before I do that, let me just say that briefly what I just said to you in English just now. So 係多謝各位大家今日嚟參加我哋今日嘅講座。咁咧，我哋因為呢2-3年啊，都係將我哋嘅注意力全部放晒喺呢個新冠肺炎同埋而家嘅3重嘅流感嗰啲流行病啊。咁我哋喺呢段時間係將佢嘅注意力搬晒一個位嘅時候咧，就將好多其他重要嘅疾病咧就係忽視咗啦。咁而家咧呢個新冠肺炎咧，其實我哋知道已經係會一路係會同我哋長存啦。咁既然係咁樣咧，我哋唔可以一路都係咁樣，其他嘅疾病唔理，淨係理呢個新冠肺炎噶嘛。所以我哋而家要翻轉頭，將我哋嘅注意力擺翻喺呢個其他嘅長期病嗰度咯。咁其中一個重要嘅長期病咧，就係我哋嘅乙型肝炎同埋呢個肝癌啦。呢個好似孖公仔咁嘅，因為咧有血型肝癌嘅個人咧，好大部分咧都可能係會將來係會變成有肝癌嘅。咁呢個係特別喺個亞裔社區裏邊咧，係特別多人有嘅。佢喺白人比較之下咧，係多好多倍嘅有肝炎啊。咁所以咧而且呢個肝癌咧嘅死亡率咧喺亞裔之中咧，亦都係高好多嘅。咁到底你有冇個肝炎咧？我哋唔知道，你一定要去檢查下先知嘅。咁如果你冇咧，你唔知道你有肝炎咧，呢個並唔等於你冇肝炎嘅喎，你可能唔知啫喎。咁如果你係曾經有肝炎而你又唔知，咁又唔去治理嘅咧，咁你將來咧可能係會有個肝啊，可能會有 大問題嘅。所以呢個今日嘅講座咧係非常之重要咯。咁我哋係好多謝你哋嚟參加我哋嘅講座。咁我哋多謝今日嘅兩位醫生啦，一位咧就係鄭希醫生，一位咧就係郭津醫生。咁咧佢哋咧就係 UCSF 加州大學三藩市分校嘅腸胃專科特別係肝科嘅駐診醫生嚟嘅。咁咧首先我介紹一下鄭希醫生啦。Okay, so let me introduce Dr. Elizabeth Sang. Dr. Elizabeth Sang is actually a transplant hepatologist and is the director of the Liver Transplant Outreach and Community Liaison Program at the University of California, San Francisco. While she treats a variety of different liver diseases, she has a clinical interest in Hep B and hepatocellular carcinoma. Sometimes we call that HCC in short. She has a research focus on Asian liver health and improving access to specialty liver care among the underserved communities. 咁鄭希醫生咧係一位肝臟移植嘅病學家嚟嘅，佢亦都係加州大學舊金山分校肝移植外展同埋社區聯絡計劃嘅主任。咁雖然佢咧治療不同各種嘅肝病啦，但係佢對乙型肝炎咧同埋肝細胞癌咧係具有特別高嘅臨床興趣嘅。佢嘅研究嘅重點咧就喺亞裔嘅肝臟健康同埋改善服務，特別係對呢啲欠缺服務嘅社區咧，即係特別係唔識講英文嘅人啊，或者係新移民啊咁啦嚇。咁咧第二位醫生咧就係郭津醫生啦。The second speaker with us today is Dr. Jin Ji. So Dr. Ji is a transplant hepatologist who treats patients with liver diseases and those who are awaiting liver transplants. He is an assistant professor of medicine at UCSF. He completed the medical school at the Perelman School of Medicine and Business School at the Wharton School, two great schools over on the East Coast, both at the University of Pennsylvania. He completed his internal medicine residency, gastroenterology, and advanced transplant hepatology fellowship at UCSF. In addition to his clinical work, Dr. Ji is also a clinical researcher focused on the application of artificial intelligence and digital technologies in the treatment of liver diseases. Those were two great topics to listen to him another time, because we all talk about using AI and digital stuff to help with us to manage chronic illnesses these days. So in Chinese, 郭津醫生咧就係一位肝移植嘅專家嚟嘅，咁咧佢咧係專係幫嗰啲肝病嘅患者佢哋當佢哋等待個肝要移植嘅時候咧，咁個身體要將佢擺喺一個最好嘅狀態嗰度，咁佢咧就喺嗰時候咧就照顧呢班要就嚟肝移植嘅病人咧，就將佢哋嘅肝嘅狀況咧改良，等佢做手術嘅時候咧嘅成功率係高好多嘅。咁咧佢就係加州大學舊金山分校嘅醫學助理教授啦。咁佢咧就係賓夕法尼亞大學嘅普雷爾曼醫學院啊，同埋呢個曉頓雙科學院。呢個曉頓雙科學院係非常之出名嘅。完成咗醫學院嘅學業啦。咁咧佢咧就喺我哋嘅加州大學舊金山分校嗰度就完成咗內科嘅住院醫生，即係佢讀完咗大學畢業之後醫學院畢業之後咧就飛咗過嚟三藩市啦，就喺呢度做住院醫生。咁啊跟住咧就專科呢個腸胃病科同埋晚期肝病同埋移植肝病嘅研究。咁咧除咗臨床嘅工作咧，郭醫生咧係一名臨床嘅研究員啦。亦都專注喺人工智能同埋數字技術喺肝病治療中嘅應用嘅。So today we're going to have a special arrangement. I'm so thankful for these two physicians. Dr. Sang is going to speak in English and Dr. Ji is going to speak in Mandarin. So, and I know a lot of you do understand Mandarin, and so that's great. And I want to thank Dr. Ji for doing that. 咁今日咧就係鄭醫生咧就係用英文講咧，咁郭醫生咧就係用國語講嘅。咁大家陣間咧就會聽到呢兩位醫生咧就大家喺每一個幻燈片嗰度嚟到做佢哋嘅互相嘅對話嘅工作啦。咁so I'm going to thank you so much for Dr. Sang and Dr. Ji for joining us today. 多謝你哋兩位嚟參加。So I'm going to turn the podium over to you, and I'll move the slides for you.
Okay, thank you so much, Diana, for inviting us and to the Asian Health Institute for sponsoring this event. So we're really excited to shift the focus from COVID over to hepatitis B, a virus that we see very frequently. We want to start off first with just introducing the liver, which is the organ that we're most interested in and the organ that is most affected by hepatitis B. So the liver is a large organ that's located in the right upper part of your abdomen, right below the diaphragm.
就是感谢大家来邀请我们今天来参加，然后邀请我们就是来跟大家讲一下肝病的这肝病再加上乙型肝病的这个问题。就首先来说，就是这个肝是人体最大的一个器官，是位于在那个横膈膜的下方，在的腹部的右上边。
And so the liver has many different functions. It can filter and detoxify blood. It metabolizes medications. It plays a role also in maintaining a healthy immune system. And it produces different substances like proteins that are needed for blood clotting, enzymes that can break down food into fuel for our body. And it also can produce bile to help the body digest fat from our food.
我们就讲这个肝到底是有什么功能？肝其实在我们的身体上其实是有很多功能的。第一是帮助我们过滤那个血液，第二是代谢药物，第三是帮助我们的免疫力，就是抵抗任何那个感染。然后第四就是这个肝脏是制造或者是生产各种各样的蛋白质，这些蛋白质是帮助我们凝血，帮助我们消化，然后肝脏也会制造这个胆汁。
The reason why we care is because the liver can be injured and these functions can all be altered. And so there are many different things that can cause inflammation and injury to the liver. There's very common causes of liver injury these days, and certainly not limited to these types of causes. But some common causes include alcohol, hepatitis B, hepatitis C, fat in the liver, and autoimmune hepatitis.
我们现在就讨论这个肝脏损伤和肝脏受伤是因为是什么原因？具体来说，就是有很多东西可以造成那个肝脏发炎和肝脏损伤。最常见的这些造成肝脏损伤的原因是，第一就是酒精，第二是乙型肝炎，第三是丙型肝炎，第四是脂肪肝，然后第五就是自身免疫性肝炎。
And so the biggest question is why do we care? Why is liver injury bad? So liver injury over a long period of time can cause fibrosis or scar tissue to build up throughout the liver. And this eventually can lead to cirrhosis. So you start off with a normal liver and something can injure the liver. So say, for example, alcohol can cause injury to the liver for a long period of time. And over that period of time, that can cause fibrosis or scar tissue to build up within the liver. And as the scar tissue and the fibrosis continues to build up in the liver, that causes cirrhosis. And cirrhosis can lead to very dangerous complications.
就是现在有个问题，就是为什么肝脏受伤是个很不好的一个现象？就为什么这是个不良的问题？就具体来说，就是肝脏如果发炎的话，就是可以造成纤维化。纤维化就是以后要是纤维化时间比较长的话，就会变成肝硬化的。所以我们这图片在左边看，就是第一个图片就是正常的肝，然后如果要是受伤的话，或者是受损伤的话，这个肝有可能就开始纤维化。纤维化多于超过10年以后嘛，就变成肝硬化。肝硬化其实是个很危险的一个状况。
And so just to review, there's common causes of liver injury and cirrhosis. So alcohol, hepatitis C, fat in the liver, autoimmune hepatitis, and it's not limited to these causes. But the main thing that we would like to focus on today is hepatitis B, which is a very common cause of liver injury and cirrhosis.
我们就反省一下，就是最常见的这个肝脏损伤包括于酒精丙型肝炎脂肪肝和自身免疫性肝炎。可是我们今天想讨论这个乙型肝炎因为乙型肝炎特别是在亚裔人口里面是一个很常见的一种肝病。
So hepatitis B is a worldwide problem. So if you look at this global map, you can see that there are certain areas in which hepatitis B is more common. So it's more common in the areas that are in dark blue, so in parts of Asia, Africa, and South America, and it's less common in parts where you see that there's lighter blue, such as in the US here. But worldwide, 240 million people are infected with hepatitis B. 1.7 million people have been treated. And unfortunately, hepatitis B contributes to about 1.45 million annual deaths.
乙型肝炎其实正是一个全球性的一个问题。我们可以看右边这个图片，就是这个世界地图上乙型肝炎是在亚洲、非洲和南美洲是一个很普遍的一种感染。我们现在的数据就是说，大概全球有2.4亿的人受到感染，然后170万的人受到治疗。乙型肝炎每年估计能造成个145万人死亡。
And so just a brief overview about hepatitis B. So it's a virus that predominantly infects the liver. We can diagnose hepatitis B with just a blood test. And if you know that you do have hepatitis B, you should also be checked for hepatitis C, HIV, and hepatitis D, because sometimes you can get both viruses or all the viruses at the same time. And most importantly, if you haven't been tested for hepatitis B, or you don't know if you have been tested, you should ask your doctor about getting tested.
乙型肝炎是一个很常见的一种肝病，然后乙型肝炎是一种感染，就是专门影响肝脏的一种病毒。我们其实可以用验血来检测有没有乙型肝炎。如果某一个人有乙型肝炎的话，那这个人也应该被查有没有 C 型肝炎或者是丙型肝炎，也得查这个 D 型肝炎或者是丙型肝炎。如果你以前没有被查过乙型肝炎，或者是根本就不知道的话，应该问你的医生怎么检查掉。
So how is hepatitis B spread? So in general, it's spread through blood, semen, or other bodily fluids of an infected person. So just wanted to review some examples of hepatitis B transmission. So if a pregnant person with hepatitis B can infect the baby that they're carrying, contact with the blood or open wound of an infected person with hepatitis B, sex with an infected partner, sharing needles or syringes with an infected person, sharing razors or toothbrushes with an infected person, or getting exposed to infected blood from needle sticks or other sharp instruments.
这个问题就是问，就是这个乙型肝炎是怎么传染的？具体来说，就是乙型肝炎传染的过程是得需要跟另一个人的体液有网流，所以乙型肝炎可以从血液，可以从精液，可以从各种各样的体液来被传染掉的。我们给你一些例子，就说看是怎么样传染乙型肝炎。第一种方式就是，如果一个感染者就是母亲在生孩子的时候，这可以传乙型肝炎。第二就是，如果是任何情况有那个血液有接触，这也是能传染到的。第三就是在性行活动也可以传染到。第四就是如果公用针或者是公用注射器也可以传。第五就是公用剃须刀或者是牙刷也可以传的。然后最后就是如果某一个人得到那个针的刺激的话，这也可以传到那个 乙型肝炎的。
And I think it's important to note how hepatitis B is not spread. So you cannot get hepatitis B through breastfeeding, coughing, sneezing, hugging, eating meals together, or sharing a bathroom or sharing toilets. So you can't get hepatitis B by using a public restroom.
我们也得需要讨论一下，就是这个乙型肝炎是怎么不会被传染的。就是我们这里说清楚，就是你不可能得到乙型肝炎，就是如果从哺乳、咳嗽、打喷嚏、拥抱、一起吃饭、共用厕所，这些都是传染不到乙型肝炎的。
And knowing that, hepatitis B is a very common virus, the WHO or the World Health Organization has proposed a goal of eliminating hepatitis B by 2023. Unfortunately, that's next year, and I don't think that they'll be able to achieve that goal. But they have proposed that they would like to eliminate hepatitis B by improving screening and diagnosis, increasing access to treatment, and emphasizing prevention. And so I'd like to spend the next couple of slides talking more about how we can prevent hepatitis B.
我们这个世界卫生组织其实以前提到一个目的，就是到2023年会完全消除这个肝炎。可是明年就是2023年了，所以这个目的可能是不会能达到的。可是在那时间，就是这个世界卫生组织推荐了3种办法怎么来就是消除这个肝炎。第一就是增加筛查和诊断，第二就是改善治疗，第三就是加强预防。所以我们下面会讨论一下怎么加强预防。
The most important thing is that hepatitis B is preventable, and it's preventable through a vaccine. So if you don't have hepatitis B and you haven't had the vaccine, you should ask your doctor about getting one. The hepatitis B vaccines have been available since the 1980s. So there is a lot of data that have shown them to be safe as well as effective. The response rates to the current vaccines are greater than 90%, and protection can last at least 20 years, possibly lifelong. And in the US, all infants are recommended to get the hepatitis B vaccine within 24 hours of birth. And certain countries across the world have also adopted this vaccination strategy and have shown that hepatitis B rates have significantly decreased.
这是一个很重要的事情，就是来说，这个乙型肝炎其实是一个可以避免、可以预防的一个病。如果你没有乙型肝炎的话，如果你以前没有打过疫苗的话，你应该问你的医生是不是应该打疫苗。这个乙型肝炎的疫苗就是大约1980几年就都已经有了，加上这些乙型肝炎肝炎的疫苗是很安全，有效率是超过于90%。如果有这个打完疫苗，然后有抗体的话，这个抗体保护时间是至少多于20年的。所以在美国，我们现在所有的婴儿都出生以后，在24个小时之内必须得打这个乙型肝炎的疫苗。
And thankfully, there's different types of vaccine options that are available to us. So you can get the hepatitis B vaccine in 2, 3, or 4 doses. Some of the hepatitis B vaccines also include the hepatitis A vaccine. And hepatitis A is also a virus that can infect the liver. And you can be fully vaccinated against hepatitis B as quickly as 1 month. So if you were to get the hepatitis B vaccine today, you would go back for your second dose in 1 month, and you would be fully vaccinated. There is a new hepatitis B vaccine that was recently approved, and it prevents all the subtypes of hepatitis B. So fortunately, our vaccines are becoming more and more effective.
这个乙型肝炎的疫苗其实有各种各样的选择。我们现在有各种各样的这个乙型肝炎的疫苗，就是可以打2针，可以打3针，或者打4针，就是完全打完的。有些乙型肝炎的这些疫苗还包括甲型肝炎的疫苗，甲型肝炎也是一个 就是能影响肝的一种被传染的病。现在就是如果某一个人选择打这个两针的这个疫苗的话，在1个月之内就可以把这个乙型肝炎这个针全部都打完。然后最新的这个乙型肝炎疫苗叫 Prehab 就现在可以避免各种各样的乙型肝炎的亚性。
If you have hepatitis B, many people ask us if hepatitis B is treatable. And so there is medicine that is available to suppress the virus. Unfortunately, hepatitis B can hide in the liver, so it can be difficult to cure and completely get rid of. But it's also important to remember that not everybody needs hepatitis B medicine, but everybody who has hepatitis B does need to be monitored for the rest of their life.
下一个问题就是乙型肝炎能不能可以治疗？乙型肝炎是其实可以治疗的，我们现在有很多种药来抑制或是压制这个病毒。可是这是一个问题，就是这个乙型肝炎是可以隐藏在肝里面，所以这是很难治愈的一个病毒，一个感染。可是我们还得记一件事情，就是乙型肝炎的患者不一定非得需要治疗的，也就是我们现在这些协会有各种各样的资格，推荐谁应该治疗。可是即使乙型肝炎的患者没有得到治疗的时候，他们也是得监测这个疾病。
And the reason why hepatitis B needs to be monitored is because the virus levels can go up and down. So sometimes it can be high at some point in your life, and then at other points in your life, it can be low. And as the virus levels go up and down, so does the inflammation in the liver, and so do the liver tests. So, for example, if the virus level goes up, sometimes we see a lot of inflammation in the liver, and therefore we can see that the liver tests become higher.
乙型肝炎是完全需要监测，所以说，如果您是个乙型肝的患者，就是应该每几个月查你的血，监测你的这个病量。这个乙型肝炎的病毒数量有时间偏高，有时间偏低。然后总体来说，如果这个病毒那个数量要是越高的话，就是这个炎症是越多。所以如果你的这个细菌数量要是高的话，就是更容易有那个肝里面更容易发炎。
And a lot of our patients ask us why they even need to be monitored if they feel well, because most people actually with hepatitis B feel quite well and don't know that they have hepatitis B. Well, it's because hepatitis B can cause inflammation and fibrosis to build up in the liver. And we know that inflammation and fibrosis building up in the liver is bad. And while that happens, people don't actually have any symptoms. So if there is a lot of inflammation in the liver and the virus levels are high and you continue to get monitored, your doctor will be able to pick that up and then talk to you about medicine for hepatitis B. Also, if they find that there's a lot of fibrosis in the liver, you might also need medicine for hepatitis B at that point.
其实还有一个问题就是，即使我没有任何症状，为什么得需要检测乙肝炎？其实这个问题就是肝病，特别是乙肝炎，会很容易造成这个肝里面得到纤维化和得到那个炎症。然后肝病其实是一种沉默的疾病，就是大部分的人都是没有任何症状的。所以如果你的医生在你的身体里面查到肝里面有很多盐，或者是你的这个病毒数量比较高的话，你的医生有可能会跟您说，就是得需要吃药来为这个乙型肝炎的。如果你的肝里面要是有很多纤维化都已经纤维化比较严重的话，那么可能也得需要吃药。
And now I'd like to shift the focus over a little bit to liver cancer. And the reason why is because hepatitis B is a risk factor for liver cancer. So if you know that you have hepatitis B, you may qualify for liver cancer screening. And the reason why we promote liver cancer screening for certain people with hepatitis B is because routine monitoring can detect early liver cancer. And the earlier that liver cancer is detected, the more likely it can be cured.
好，即使我没有任何症状，我能不能还可以得到这个肝癌症？其实这也是个很重要的一个问题，就是肝癌症也是一种沉默的疾病，就是根本就没有很多人都是根本就没有什么症状的，所以我们也知道这个乙型肝炎是一个高风险的状况，为了这个造成这个肝癌，所以如果你有乙型肝炎的话，你有可能有资格获得这个肝癌筛查。肝癌筛查其实就是能找到早期肝癌，早期肝癌是很容易治疗成功的一个状况。
And so there are certain populations of people with hepatitis B who are at the highest risk of developing liver cancer. So people with hepatitis B, and so if you have hepatitis B and you're an Asian man over 40, or an Asian woman over 50, an African man over 20, or anybody with hepatitis B and cirrhosis, anyone with hepatitis B and hepatitis C, and anyone who has hepatitis B and has a first-degree family member with liver cancer, these are all the people who qualify for liver cancer screening.
这些人有增加的风险或者是几率能得到肝癌的，就是如果就这些人就是如果有乙型肝炎，有更大的风险得到肝癌，这就包括40岁以上的亚裔男性、50岁以上的亚裔女性、20岁以上的非裔男性，任何人都已经有肝硬化的，任何人有地型或者是丙型肝炎。然后任何人就是他如果家人以前或者现在有这个肝癌的。
And so again, the people who are at higher risk of developing liver cancer should get screened. And the most important part about remembering why you should get screened is because if you get screened, we can detect the liver cancer early, and early liver cancers can be treatable. So screening really can save your life.
所以这就是总体来说，我们再说一遍这个肝癌筛查，谁应该获得肝癌筛查？就是高危患者应该获得肝癌筛查。然后筛查就是能测找早期的肝癌，早期的肝癌是很容易治疗的，所以成功率比较高。所以总体来说，肝癌筛查是可以救命的。
Now, how often should you get screened? So if you qualify for liver cancer screening, you should get screened every 6 months. So again, if you have hepatitis B and you're at high risk of developing liver cancer, you should get screened every 6 months for the rest of your life.
所以另一个问题就是有多久就应该收到这个肝癌筛查？如果你有资格获得肝癌筛查的话，你应该每6个月收到筛查。
And how do you get screened? So the most common way to get screened is getting an ultrasound of the liver to check the liver for any new masses or growths, and then also to get a blood test to check the AFP level. And the AFP level is or the AFP is a protein that can be produced by a liver cancer.
下个问题就是如何进行筛查？筛查这个过程就是第一是做一个肝脏的超声波，第二是验血查一个蛋白质叫甲胎蛋白。甲胎蛋白是一种特殊的蛋白质，就是有一些肝癌会制造的。
Now, how is liver cancer diagnosed? So we usually diagnose it with a CAT scan or an MRI. Sometimes, but rarely, do we do a biopsy of the liver tumor. But sometimes we do need to do it to confirm the diagnosis of a liver cancer based on what we see from the CAT scan or the MRI. So, like I was saying earlier, some liver cancers can produce a protein called alpha fetoprotein, AFP. And so we use those levels to help us diagnose liver cancer. So the higher the AFP level is, the more likely the diagnosis of liver cancer is. And so that's also why we use it as a screening tool for liver cancer.
这个肝癌是怎么诊断的？肝癌诊断是一般用 CT 或者是核磁共振扫描来测着的。有时间我们得需要做一个切片就是看这个这些细胞到底是不是肝癌。有些肝癌会制造一个蛋白质叫甲胎蛋白，刚才都已经说过。这个甲胎蛋白量数要是越高的话，那就说明就是更容易是有肝癌的。
And again, liver cancer can be curable if it's diagnosed early. And so there's different types of treatment to cure liver cancer. There can be surgery to cut out or remove the tumor. You can have chemotherapy or radiation injected directly into the tumor. You can have heat applied directly to the tumor to burn it. And then lastly, and ultimately, the biggest procedure would be potentially to do a liver transplant to cure liver cancer.
肝癌是怎么样治疗呢？就是总体来说，这个肝癌如果是早期诊断是可以治愈的这个状况。然后我们这些方式来治疗肝癌，其实有各种各样的方式。第一种就是做手术，把这个肝癌给它切掉。第二就是用化疗或者是用放射直接射到这个肝癌里面，把这些细胞给杀掉。第三就是用热力把这个肝癌给它烧掉。然后第四可能是最大的手术，就是做一个肝脏移植。
And again, we want to emphasize that hepatitis B and liver cancer can be silent. And so that's why it's always important to talk to your doctor to get checked for hepatitis B if you haven't already. And if you don't have hepatitis B and you haven't gotten vaccinated, you should go get the vaccine. Also, talk and encourage your family members to get hepatitis B testing and to get vaccinated if they already are not. And then ask your doctor if you have hepatitis B to get screened for liver cancer.
乙型肝炎和肝癌就是我们都已经说了好几次了，是一个没有声音、沉默的一种疾病。大部分的人就是有乙型肝炎或是肝癌的这些患者，其实没有任何症状，所以这是很重要的。问你的医生是不是应该监测有没有这个乙型肝炎，然后如果没有乙型肝炎，没有打过疫苗，那应该问你的医生是不是应该把这个疫苗给打掉。你应该跟你的家人讨论，就是这个监测乙型肝炎，然后打这个乙型疫苗。最后就是，如果你是个乙型肝炎的患者的话，你应该问你的医生是不是应该做肝癌筛查。
And now we'd like to wrap up our talk by kind of talking about your liver in general and how you can keep your liver healthy in general. So the first thing would be to avoid drinking too much alcohol. And the reason why is because alcohol can cause fat and inflammation in the liver, and it also directly damages the liver cells. So if you are a man, you should not have more than 14 drinks a week. Women should not have more than 7 drinks a week. And if you already have some sort of liver disease, you might want to avoid alcohol entirely.
下面就是我们讨论，就是有什么手段来保持肝脏的健康。最重要的其实就是少喝酒，少喝酒精，因为我们知道酒精在这个是在肝里面造成脂肪，然后造成盐的，然后酒精也是直接伤害肝的细胞，所以男性每个星期不应该多喝不应该超过14杯酒，女性不应该每个星期超过于7杯酒。如果你都已经有这个肝病的话，或者是都已经有肝纤维化或者是肝硬化的话，就应该完全把酒给戒掉了。
Another way to keep your liver healthy is through your diet. So we recommend eating a low-fat, low-sugar, low-carbohydrate diet, and this can help to prevent fatty liver. And foods that are healthy for your liver include black coffee. So if you do drink coffee, we recommend drinking it black without a lot of sugar, without a lot of milk or cream. Other things that are healthy for your liver are vegetables, low sugar fruit like strawberries, oranges, apples, blueberries, and pears. And then also avoid eating lean protein, so fish, eggs, yogurt, chicken, and tofu. We also recommend or avoiding and drinking too much, let's say, sugary tea, sodas, or juice, and then avoid eating fried foods, rice, noodles, and bread.
然后下面就是如何保护肝脏的健康我们推荐就是应该吃一个低脂肪、低糖、低碳水化合物的食品，来帮助避免脂肪肝。这些食品是对您的肝是有好处的。第一就是黑咖啡，第二是蔬菜，第三是低糖的水果，像草莓、橘子或者是苹果等等。第四就是蛋白质，含蛋白质比较高的这些食物，像豆腐、鱼、鸡蛋酸奶和鸡肉。其实应该少吃油炸的食品，少吃白饭，少吃白面条或者是白面包，然后也应该少喝果汁，少喝含糖的这些饮料和汽水。
And then another way to keep your liver healthy is to stay physically active. And by staying physically active, you can therefore decrease the risk of getting fatty liver. And so we recommend aiming for 30 to 60 minutes of exercise 3 to 5 times a week, walking as much as you can, and also trying to lift weights and build muscle, because that can also help to decrease your blood sugar.
然后我们还推荐就是健身，然后锻炼身体。应该每天要是会去锻炼身体的话，每天锻炼30到60分钟，然后3到5次一个星期。如果能走路，就是越走越多越好，不要开车，走路。健身，然后就是可以帮助降低你的血糖。
And then lastly, we would like to conclude that having a healthy liver is important for your overall health. And so it's important to get checked for hepatitis B and to ask about getting vaccinated for you and your family. If you have hepatitis B, talk to your doctor about monitoring your liver tests and for liver cancer. And again, liver cancer can be curable if it's diagnosed early. And the way that we diagnose liver cancer early is by screening for liver cancer every 6 months. And some ways to keep your liver healthy include avoiding alcohol, eating less sugar, fat, and carbohydrates, and staying as physically active as you can.
好，总之就是保护肝脏的健康，其实是保护你全身的健康。所以，如果你以前没有被查过这个乙型肝炎的话，应该监测是不是应该查乙型肝炎。然后，如果你以前没有得过这个疫苗的话，应该问你的医生是不是应该打疫苗。你和你的家人是不是应该打疫苗？如果你都已经是有这个乙型肝炎的话，应该问你的医生是不是应该监测你的肝功能。然后是不是应该做肝癌筛查？肝癌是可以治愈的一个病，如果是早期的话可以治愈的，所以肝癌筛查是帮助我们诊断就是那个早期肝癌的。然后其他的手段、其他的推荐来保持你的肝健康，第一就是避免酒精的食品，第二就是少吃或者是多吃这个低糖、低脂肪和低糖和低脂肪的食品，然后最后就是保持身体的活动和锻炼身体。
So the first question is about how common it is for Chinese to carry Hep D. we hear about Hep B a lot. We don't hear about Hep D a lot. We hear about some Hep Cs, right? So if we have Hep B via mother to infant, so it's a vertical transmission, do we need to test for Hep D in adulthood?
So hepatitis D is a virus that needs hepatitis B to survive. So anybody who has hepatitis B has a risk of also having hepatitis D because you need hepatitis B for hepatitis D. It's not as common for people who were born in China to have hepatitis B and D. In Asia, the rates are highest in Mongolia. Regardless, we recommend anybody who has hepatitis B to get checked for hepatitis D.
呢條問題係問Hep D 同埋 Hep B， 即係咪有 Hep B 嘅人咧，一定有 Hep D， 或者有 Hep D 嘅人咧，一定有 Hep B。咁正話阿鄭醫生咧就係話你如果係有 Hep B 咧，你可以有 Hep D， 但係你有 Hep D 咧，你就一定要有 Hep B 先得嘅，要靠 Hep B 嚟到出嘅。但係大部分嘅有 Hep D 嘅人咧，都係喺蒙古嗰度啊 ，Mongolia 嗰度所以就其他嘅東南亞地區咧就唔係咁多嘅。Dr. G。
对，我就刚才准备说这个，其实这个丙型肝炎或者是 D 型肝炎，在中国不是一个很普遍的一个现象，可是我们知道是在蒙古和以前苏联的这些国家，其实这个 D 型肝炎是比较普遍的。然后巴基斯坦也是有很多 D 型肝炎的。可是我同意就是曾医生说的这个推荐，就是任何人有 D 型，任何人有 B 型或者是乙肝的话，应该是检测有没有 D 型或者是丙型肝炎，因为丙型肝炎是得需要乙型肝炎来生存的一个病菌。
Since Hep B can be detected from blood tests, should we ask our doctor to test for Hep B every time we do our annual physical?
Yeah, that's a great question. So you don't need to get it done annually. But if your doctor hasn't checked for hepatitis B at all, then yes, you should get it during your next annual physical exam.
咁呢個咧就係話你如果係從來冇查過你自己有冇 Hep B 嘅咧，你下次去睇醫生嘅時候做你個身體檢查嘅時候咧，就應該叫個醫生同你做啦。但係咧就你做咗之後咧就知道有因為冇啦嘛，咁就唔使話年年做嘅呢個 test 嚇。
So I just want to add one additional thing to Dr. Zhang's recommendations is that I agree that you only need to get tested once. I think the only exception to that is that if you do engage in high risk activities for acquiring Hep B. And so, for example, if you, for whatever reason, sharing needles with other people or having unsafe, unprotected sexual activity, then it may be worth getting tested for Hep B on a more regular basis. I can say in Chinese as well. 就是我再说一个事情，就是我同意曾医生讨论的是，如果你要是你检测乙肝炎，其实一次检测就是可以的，除非是你就是有这个高风险的这些活动。高风险活动就是如果是你某一个人就是有很多性行为或者性行活动，或者是某一个人是跟其他人的体液或者是血液有交触的话，那麼就是應該多檢測有沒有這個乙型肝炎啦。
即係通常就唔使年驗啦，但係你如果係你嘅行為係有啲做啲危險嘅行為，可能會傳染到呢個 B 型肝炎嘅，咁你或者係要真係可能要年年都去驗下咯，因為你嗰啲行為方面係可以令到你重新感染呢個乙型肝炎嘅。So the third question, if vaccines for Hep B last only 20 years, do people vaccinated at birth need to get boosters in their 20s and every 20 years? By the way, the Hep B Foundation points to lifetime immunity after vaccination. So it seems like there's some discrepancy of data. Is it 20 years or is it for life? How long does the Hep B vaccine last?
That's a great question. So yes, for some people it can provide lifetime immunity after vaccination. But for other people, that immunity doesn't last as long. And so sometimes what we do is we check for the hepatitis B antibodies to see if you still have antibodies. If you don't have a certain level of antibody, then you could get a booster hepatitis B vaccine to increase your immunity.
咁你即係可以係去 check 下啲血咯。如果嗰啲血裏邊冇抗體嘅，咁就可以打啲加強劑。如果係有抗體嘅就唔使打咯，即係唔使估嘅呢樣嘢，因為有啲人嘅身體嘅免疫力啊，咁係有啲唔同嘅。Dr. G?
I agree completely. 范先生曾医生说的回答就是，大部分的人就是打完这个乙型肝炎的疫苗的话，其实有终生的那个抵抗力。可是有一些人我们也不知道，具体也不知道是为什么，有些人只有20年或者是20年左右的抵抗力。所以其实我们可以监测抽血来检查有没有这个乙型肝炎的这个抗体。如果没有抗体的话，你的医生有可能会推荐再去打一次这个乙型肝炎的疫苗。
And this is a great question here that can a person who already has had a happy infection, do they still need the vaccine? 呢個係即係已經感染咗肝炎啦，仲使唔使再打呢個疫苗咧？
Unfortunately, because you already have hepatitis B, getting the vaccine would not be helpful. So the purpose of the vaccine is to prevent the infection. So if you already have it, the vaccine would not be useful.
Why are we more at risk for happy? What's wrong with us?
Well, there's nothing wrong with us. We are more likely to have hepatitis B because this is a virus that is more common in our population. And before there were vaccines and before there were testing for hepatitis B, this was spread through vertical transmission, Diana, like you said, through blood-to-blood contact. And so we didn't really know about it in the past. And so many of us have grandparents, parents who have hepatitis B, didn't know about it and never had access to a vaccine in the past. And so, there's nothing wrong with us or with our blood that has made us more susceptible to hepatitis B. It's just that this is a virus that was more common back in the day and was not preventable either.
咁即係呢個係直線傳染嘅，直線傳染即係話係由個媽媽轉咗落去俾啲仔女嘅生育嘅時候。咁所以咧，因為係以前咧中國或者係東南亞嘅地方咧係好多呢個乙型肝炎咧，咁咧就又冇嘢去醫佢啦，咁所以咧係好多人跟住生仔嘅時候咧，生出嚟嗰啲仔女咧又有乙型肝炎，所以係咁樣，所以係嗰啲亞裔嘅人士咧係多啲呢啲肝炎咯，就同我哋即係我哋唔係話與生俱來就一定有嘅。係好多時都係啲傳染係有個媽媽爸爸咁樣嚟。So Dr. G, anything to add?
Yeah, so I just want to say that hepatitis B is also a very, very old virus. There's been some studies that said that hepatitis B may have originated more than 200 million years ago within human population, and so it's it's just the luck of historical distribution that Asians and the countries in Asia have a high endemic rate of this virus.
That's interesting. Over 2 million years ago?
200 million years ago.
Oh, 200 million. Oh my God.
It's a very old virus.
Older than the dinosaurs?
Maybe.
So having a glass of wine, let's talk about dinner wine. Is it okay to take a glass of wine every night?
If you already have liver disease, I don't think it's a good idea to have a glass of wine with dinner every night because we want to minimize any type of injury to your liver as possible. So if you already have liver disease, you don't want to stress out your liver anymore. And we know that alcohol is a stressor for the liver. again, if you're a woman, you should have less than 7 drinks of alcohol a week. If you're a man, less than 14 drinks of alcohol a week. I personally, as a hepatologist, think you should have less than that. And if you can have no alcohol, that would be even better. Dr. G, do you have other recommendations?
I agree completely with you, Dr. Zhang, and I would just say that sort of like it's more of a problem. Alcohol is, if you have liver disease, you have fibrosis, 就是如果你有肝病，然后如果你有肝纤维化的话 and especially if you have cirrhosis, 就是如果你有肝硬化的话，就是一杯酒是很危险的。Even one drink is very dangerous because it's going to worsen your liver disease.
That's good to know. 如果你有肝病，你就唔好飲酒啦，一杯都唔好啊。So, what are the initial symptoms of HEPI? We talked about it so much earlier, asymptomatic, right? So, any symptoms at all for HEPI?
Yeah. So unfortunately, hepatitis B, there's no symptoms. And the symptoms that we see are later on in the disease. So like jaundice, like yellowing of the eyes, that's the most obvious symptom. But that's already in the later stages when hepatitis B has already caused a lot of damage to the liver. So no initial symptoms of hepatitis B.
And I just wanted to add that it also depends on when you acquired hepatitis B. For most of our populations within the Chinese American and Asian American communities, the people who have chronic hepatitis B are the ones who got it from mom through vertical transmission. For the people who end up getting hepatitis B later in life because of whatever activities they do, they may have symptoms as the initial part of the acute infection. But for our patient population, it's a silent disease.
郭醫生話咧，我哋華人嗰啲呢個肝炎啊，好多時都係由出世嘅時候已經有噶啦，係由媽媽嗰度傳落嚟嘅，所以咧係完全冇症狀嘅。咁咧就佢話，如果係，但係如果你係後尾嘅時候大啲嘅時候先至感染到，因為你嘅行為而感染到嗰啲乙型肝炎咧，咁佢話嗰個咧就可能會有啲症狀咯。不過都係好輕微，你好多時都唔察覺嘅。譬如係個人好容易攰啊嗰啲咁樣，成日都攰噶啦，我哋點知道係 HB 啊係咪？所以你都唔好只係話睇到 symptom 先去驗啊，係要去揾醫生去驗血啊嗰啲先驗到出嚟嘅。Presence on the coffee again. Okay, how many cups of coffee do you recommend? So you said no alcohol, right? Can we have coffee if we have no alcohol?
Yeah. So no alcohol, but you can have coffee, and we recommend black coffee. Doesn't matter. So we don't know, what brand of black coffee. We don't endorse any particular brand. And and the studies that we've seen also don't really tell us exactly how many cups of coffee. So, everything to moderation, I would say 1 to 2 cups of black coffee is okay. Dr. G, do you agree?
I've seen some studies where they said that up to 4 cups of coffee can decrease your risk of cirrhosis by 65%. So, once again, it's really dependent on what your particular health situation is, but 4 cups of coffee may cause other problems.
It feels like a lot of coffee.
You're probably going to the bathroom quite a bit.
Yeah.
And no sleep. Okay. 咁我就話飲咖啡，飲幾多杯咖啡一日可以？咁啊，Dr. G話如果你可以有一啲研究咧，就話飲夠一日飲4杯咖啡咧，就可能會減低呢個肝纖維化嗰啲咁嘅肝硬化啲咁嘅情形嘅。但係佢話如果你飲咁多咖啡咧，可能個肝冇事，第二啲嘢有事咯。最得喺度你成日去廁所咧，成日飲咁多咖啡係咪？ So is sugar bad for our liver? How bad is it?
Yes, sugar is bad for your liver because if you have too much sugar, you're at the risk of developing diabetes. And diabetes, we know, is a risk factor for developing fatty liver. And fatty liver is bad because fat can cause inflammation in the liver, and that can cause injury to the liver. So that's why we always say to avoid sugar, to essentially avoid fatty liver.
咁啊，鄭醫生咧就話：你如果係食好多糖或者甜品嗰啲嘢咧，其實而家好多人都好中意食甜品嘅，係咪？又飲波霸奶茶嗰啲，通通都好甜嘅。你如果食得太多糖嘅嘢咧，咁咧就會增加有呢個糖尿病嘅風險嘅。而有呢個糖尿病嘅風險咧，就係直接會增加呢個脂肪肝嘅風險嘅。咁你有脂肪肝啊，咁樣可能肝硬化，跟住整到肝炎咯。所以如果係食得糖多咧，就對個肝係非常之唔好嘅。Dr. G?
Yeah, I agree. It's sugar causes fatty liver, and fat in the liver can cause inflammation. And actually, you know, a lot of the pathways of how liver disease, how fatty liver disease occurs is very similar to alcohol-related liver disease, where the substance is being metabolized into fat, and that causes inflammation inside the liver.
即係其實即係好似飲酒咁啦，飲咗啲酒裏邊好多糖噶嘛，咁啲糖咧就會即係又會影響增加多脂肪肝嘅。咁如果係 so here's an interesting thing. If someone has Asian glow, how much alcohol is recommended? 0, right? I hear the Asian glow increases risk of liver cancer. What do you think?
Great question. So
wait a minute, what's Asian glow first?
Okay, so I'm assuming Asian glow is when you turn red or when you have this flushing reaction after you drink alcohol. Scientifically, it's because some Asians can have, I guess, a genetic alteration in that they don't have a certain enzyme that metabolizes alcohol. And so a certain type of alcohol product builds up in the body, and that causes the flushing reaction. And that product that doesn't get broken down can accumulate in the liver, and that can increase the risk of getting cirrhosis more quickly, or increase the risk of developing cirrhosis in general. So yes, I do think that if you have the flushing reaction, or if you do have a bad reaction to alcohol, it would be best to just minimize or just not drink. Dr. G? Yeah,
I agree. So the exact enzyme that's sort of like, or the substance that builds up, is something called acetaldehyde, which is a toxic byproduct of alcohol metabolism. And it's actually not just cirrhosis or liver cancer that has an increased risk, but also stomach cancer. And I think the most notable thing is actually esophageal cancer. And so, you know, the CDC does not give specific guidances on this subpopulation, because most of the public health guidance is for the overall general population. But if you do have Asian glow, you probably shouldn't be drinking.
Yeah. Bad news, guys. No alcohol for the holidays. So maybe if you're in a party and you see somebody having the Asian glow, and they still kind of like act like that they are this big guy that can drink lots of alcohol, I don't know. Should you walk up and tell them, "Hey, buddy, don't drink anymore"? Should you do that or no?
Well, I mean, it's we can help educate, but it's ultimately their own personal choice. So
how is Hep B different than Hep C or D?
So hepatitis C and hepatitis D are different. They're just different viruses, so different infection. Hepatitis C is primarily transmitted through blood. And hepatitis D, again, you need hepatitis B to get hepatitis D. The treatment for hepatitis C is very different than treatment for hepatitis B. And hepatitis C, there's actually a cure for. So if you take medications for a certain amount of time, you can actually get rid of hepatitis C now.
咁即係Hep B 同埋 Hep C 同埋 Hep D 咧，係3種不同嘅動物嚟嘅。咁就而家 Hep C 咧就已經有可以係完全治療嘅。如果你有錢就得㗎，你有錢買呢隻藥咧，食咗咧就可以 100% 痊愈嘅差唔多。咁Hep D 咧就如果你有 Hep D 咧，你就一定有 Hep B 嘅，因為 Hep D 咧係要靠 Hep B 佢先至會有出現嘅。咁所以就但係每樣嘅發炎都係唔同，有唔同嘅病毒去形成嘅。So the next one is Asians love rice, noodles, and bread. Oh my God, what are we going to do now?
I can take that one. Basically, the goal is to try to have decreased starches or decrease empty carbohydrates in your diet. And so, if you really love your rice, noodles, and bread, the alternative is actually to switch to whole grain. So instead of doing white processed rice, do brown rice. Instead of eating white noodles, get whole grain noodles. Instead of getting white bread, get whole grain bread.
即係將佢改變下咯。即係你如果真係要食粉麵飯嗰啲嘢咧，你就食一啲啡色嗰啲米啊，有嗰啲康谷嗰啲麵包啊咁咯。即係將佢盡量係嗰個血糖嗰個吸收嘅情況係將佢延遲減慢啲，等個血糖冇升高得咁快。Now how about eating red meat like beef? I think people thinking about dinner now. They're asking all these food questions. How about eating red meat like beef? Is beef bad for our liver? I mean, beef is bad if you eat too much, right? But how specific to our liver is beef bad about?
I don't think, your liver will be harmed if you have a piece of steak tonight. But consistent eating of beef is not good for your overall health because beef is a pretty fatty type of meat. And so you would want to avoid that to decrease your risk of heart disease and, also for fatty liver. So I think that's why, again, everything in moderation, including fatty meat like beef.
即係自己睇住嚟食啦嚇，唔好日日食牛扒啦。If you have fatty liver, how can you change it? Can it be cured?
Yes, it's diet and exercise. Losing weight. So fat that is in your body ends up going into the liver, and getting rid of the fat in your body gets rid of the fat in the liver as well. People don't like it when I say that.
Yeah, because there's no medicine to treat fatty liver.
冇藥醫啊，慘啊！要靠你自己運動同埋去睇住你食嘢有節制啊 ，OK， 唔好食啲肥嘢。咁樣你喺減到肥咧，就連脂肪個肝裏邊嗰啲脂肪肥咧都會減咗噶啦。Oh, look at this one from Kai. No, I see a lot of Asian growers drinking. Big guys too. That's why I say a lot of people, even though they turn red, they just act like it's okay. They can still keep on drinking. They don't know that they're at higher risk for fatty liver. So I've heard people say that some amount of alcohol is good for you. What is the science behind this alcohol in moderation is good for you theory? And how do you counterbalance that with the Asian glow?
I think that theory came out because there have been some studies that have shown that wine, like red wine, is good for your heart, for cardiovascular health, like having a glass of red wine a night. And I think that came because some of them, some alcohol or wine can increase certain types of good cholesterol, and it can also produce antioxidants that are good for you in the body. But I will say that more studies have come out that kind of haven't really shown that exactly. And we also know that, you kind of have to balance that with your liver. So we know that any amount of alcohol is not really good for your liver because, again, alcohol is a direct toxin to the liver. So we as liver doctors always recommend drinking as little as possible or just cutting out alcohol.
Yeah. And I think one additional thing to be realized is that, some of the data initially was behind red wine, but you have to think about what else that the people who were drinking red wine were doing. And there's something, what the red wine was probably not a marker that the red wine is actually good for you, but more like an indicator about the behaviors of people who drink red wine, who may have, those behaviors may be protective of cardiovascular disease. And so this is the difference between causation and association.
It looks like there's a question from Wendy. With functional cure for Hep B on the horizon, can you talk briefly about clinical trials and things to consider for hepatitis B patients regarding participation? Yeah, that's a really great question. So yes, there are some hepatitis B medications that are currently in clinical trial in phase 3 clinical trials. So basically seeing if these medications are safe for the general public to use. But I think we're still maybe like 5-10 years out from hepatitis B actually being available and being able for us to prescribe it. And unfortunately at UCSF, we don't yet have the clinical trials for hepatitis B medications just yet. But I think that's also an important reason why you need to, stay in touch with your doctor about monitoring for hepatitis B so that when these medicines are ready, you could get prescribed Hep B treatment.
I think there's one last question, which is in Chinese. And I think the gist of the question is basically asking what causes elevated liver function tests and if persistently elevated liver function tests can lead to liver disease. And so to answer that, basically, when the liver function tests are elevated, this means that there is some sort of inflammation or something that's hurting the liver. And so this actually, if it persists for a long time, it does require a workup with your doctor to see what is causing the damage or causing the inflammation in the liver. It typically, in some circumstances, elevations of liver function tests can indicate liver disease. And so it's something that you should follow up with your doctor and to get worked up for.
So about the doctors, about the primary care physicians, when we go and see them for our annual checkups, not everyone follow the protocol about this every 6 months testing for people with high risk for liver cancer. You actually do not see a lot of every 6 months ordering for alpha fetoprotein for the blood test, as well as for the liver sonogram. I think that you'll be lucky if you get it ordered once a year. And one of the things, I actually talked to some of them, and what they say is that, well, we see a lot of liver cysts in our patients anyways. And they are usually just very benign. So we just don't routinely check them because, it scares the patient to find cysts in their liver and alarm them. So what do you think about that? 即係好多醫生唔同我哋做嗰個6個月嘅檢查㗎。So for people who have a history of chronic Hep B or at high risk at, getting liver cirrhosis and liver cancer.
I think that sometimes as a patient, you have to advocate for yourself. So knowing that you have hepatitis B and you might be at increased risk of getting liver cancer, if your doctor is not ordering you an ultrasound every 6 months, I think it's important for you to also remind your doctor to get the ultrasound. And, it's scarier to be diagnosed with late stage liver cancer than it is to be diagnosed with a small tumor in the liver that is potentially very and easily treatable.
Yeah, a few more questions. We still have a few more minutes. Do you want to quickly take this? And it actually has something to do with about vaccines, because we ask people to get vaccinated, right? If you never had Hep B and you have never been exposed, then let's don't get you exposed to Hep B, in the future. So we ask you to take vaccines, but we are so vaccinated out, without the COVID vaccines. And then people will worry, well, are we going to be taking too many vaccines these days? It's like, we're already worried about taking all these COVID vaccines, and now you're asking us to take the Hep B vaccine, for those who hasn't been vaccinated. Is it safe?
Yes, absolutely safe.
即係你就算係打咗好多嘅新冠疫苗，你都唔怕話再去接種呢個肝 這個乙肝嘅疫苗咯，係不同嘅疫苗嚟㗎嘛。Is there a waiting period that after you take the COVID vaccine that you have to wait before you take the Hep B vaccine?
Nope. You can take your vaccine whenever you want. You
Okay.
can take multiple shots on the same day. It's whatever your arm can tolerate.
So you can actually take it on the same day, one in each arm, right?
Yeah. Or in the same arm.
即係你唔使等咯。你如果係要打呢個疫苗嘅，你可以一齊打，同日打都得嘅。如果你係可以有呢個疫苗可以打嘅話。So for people who have had COVID, and a lot of people already had COVID, people with chronic hepatitis, would they get sicker when they get COVID?
So we have to make a distinction between hepatitis or liver disease without cirrhosis and those with cirrhosis.
Oh.
If you do have cirrhosis from liver disease, you are absolutely at higher risk for complications from COVID. And some of the data that I've done research on says that basically if you have cirrhosis, your risk of death from COVID is actually 3 times as those without cirrhosis.
Oh. 即係要睇下你個肝有冇硬化，呢個答呢條問題話，即係我哋話如果你有呢個新冠肺炎嘅話，咁如果你曾經有過呢個乙型肝炎嘅感染嘅，會唔會係會病得更加重咧？咁郭醫生咧就話，咁要睇下你個肝係咩嘅情況啦。如果你有已經有好多肝硬化嘅情況咧。咁你咧就感染咗呢個新冠肺炎之後咧，你個死亡率係會比冇肝炎嗰啲人咧係高出3倍嘅。咁所以呢個係一個非常之重要嘅嘢嚟嘅。如果各位在座嘅人士或者你嘅親戚朋友諸如此類啦，如果你知道佢個肝有硬化咧，佢真係要去打疫苗，真係要離開其他嘅人群，因為佢嘅死亡嘅風險咧係會增加嘅。如果佢得到呢個新冠肺炎。Will people with chronic Hep B have a higher chance of getting long COVID? Now we are moving on to long COVID, from getting COVID to getting long COVID.
So I think the data for that is still evolving, and we're not quite sure if chronic Hep B is associated with long COVID.
Okay.
More research needs to be done.
Okay. 而家暫時未知，因為唔係咁，即係呢個長新冠唔係出咗咁耐咯。So for the chronic Hep B carriers, are there ways to prevent the flare-up of the Hep B virus?
Yes, there are ways to prevent it. The first is that if you're a carrier of hepatitis B, so your viral load is very low and you're not on medication for hepatitis B, and for some reason your immune system is weakened. Usually it's with medications that weaken your immune system. So like high-dose steroids, chemotherapy, medications that specifically suppress your immune system. Those people with hepatitis B and are not on medication or carriers of hepatitis B or have been exposed to hepatitis B in the past, those are people who have an increased risk of flare-up. If you already have hepatitis B and you're not on medicine, sometimes we don't even know if you're flaring, and that's why it's important to get routine monitoring to see that on the blood work that the liver enzymes are high, that the virus level is high. So there's ways to detect a flare-up, and if you are flaring, that's when your doctor might put you on Hep B medicine.
That concludes our Hep B thing, and so we want to thank all of you for taking time off your busy schedule. I know you're extremely busy, and taking time to do the slides and coming here to give this talk to us, Dr. G and Dr. Zhang. And we also want to thank our great staff, Cliff and Raymond. So we just want to really, in closing, letting you know that there is an email that you can send us, ahi.ucsf@gmail.com. And if you want to be added to our listserv so that you can receive these meeting notices and other information, write us and just say, add my email to listserv on the subject line, and then we'll do that for you. And then we do have a website, ahi.ucsf.edu, and it's a bilingual website in both Chinese and English, and it's even in both traditional and simplified Chinese. Isn't that cool? So we're also on Facebook if you want to follow us, and on YouTube. If you just type in Asian Health Institute, all the past seminars that's up on the YouTube will come up, including this one. So now we thought that the pandemic was over, but hardly. It's actually ramping back up again. Just want to remind you that the rates are increasing, new cases are going up, hospital beds are getting filled. Please don't add to our statistics of being a new case. As much as possible, please stay vigilant because the government is not telling you what to do. Now you are going to decide what to do. When you go out, do you want to go out? Well, it depends on how well you feel, right? If you have symptoms of respiratory illnesses, then please don't go out, and because we don't know what you have. Have you been vaccinated? If you haven't, well, then please do. Have you been boosted? Are you qualified? If you are, then please do. I just heard the news in Hong Kong today that they're allowing people 18 years and over to take the booster, the new booster shot. So, which is great. Here we are still going at age 50 and over, or the high-risk individuals, or people who work in high-risk job environments. So we do have a new vaccine. So the bivalent vaccine works a lot better, works very, very well, even with the currently circulating virus, the BQ1 and BQ1.1. They work well with it, as well as the BA5 from the earlier circulation. Testing, you have to test. The government is, well, not the government, but your insurance still allow you to pick up 8 kits, the rapid antigen testing kits from the pharmacy stores. All you have to do is just go there and show them your health insurance card, and they'll allow you to take 8 kits every month. Then you can use it for testing, like when you go to parties, especially if the party has elderlies or people who are at high risk. You want to test yourself before you go so that you are not carrying a virus and then go there and infect others, right? And masks, we didn't realize how good the masks are until a couple of years now that we've been wearing masks over the winter. And you know what? The flu rates were dropping so significantly. Now, this year it didn't work because the virus is more transmissible, and the flu virus was also hitting us earlier, and people are dropping their mask wearing habits. And so the flu rates are going up through the roof. The RSV rates are going up through the roof, and our children's hospitals are getting very filled up with the beds. And so let's don't overburden the healthcare system. We do not want to have people that we have to build tents outside the hospital to accommodate you. The emergency rooms are very filled, and people are staying in the emergency room and cannot get a bed upstairs to the regular patient rooms. So the emergency rooms are just all blocked out and filled with people. Let's hope that you won't be one of the people waiting there. Ventilation, we know, is very, very important because this is a respiratory virus. And so as much as possible, open some windows, even if you're indoors. And if you have events, it's better to have them outdoors. There are some restaurants that you can have eating outside, which would be much better than, if you have to eat indoors. And the regular, hygiene habits of regular hand washing, frequent hand washing, and don't touch your face and everything else with your hands everywhere, those kind of habits needs to stay. And so the pandemic is not over. As a matter of fact, we are facing a triple-demic. We have the 3 viruses hitting us all at once, and we're in a bad shape. And the holidays are coming, and people are going out there visiting, and then people are acting like that there's nothing, that there's no infection around, like, they don't wear masks, they just go everywhere, and they don't do tests. So those are risky habits, and I hope that you don't do that because we don't want you to, get infected. Because not just because you get the COVID, then later on you might be one of the people getting long COVID. And we know so little about long COVID still. There's so much research still going on. So it's better not to risk it. So we hope that you stay well and have the happy holidays. And we also thank you for joining us. And we always appreciate you taking time to learn with us. And we always have great speakers. I don't do well, but the speakers always do very well. So I want to thank you for your taking time to join us. And so I want to thank Dr. Zhang and Dr. Ji again to help us keep in, within the time frame. And again, thank you everyone. And happy holidays. I won't see you until next year in January. So bye-bye. Thank you so much.
Bye, thank you.
Bye-bye. Thank you.
Thank you，谢谢。